ma'am, despite many advancement in diagnostic, why do these diseases still go undetected?
Maybe what happens is, suppose these tribal areas, the disease, if I talk about scrub typhus, now it isn't mainly in the tribal regions or where the agricultural land, so mainly it is rural regions. So what happens when the patient gets fever, they try to just they feel that it will be all right in 2 days, 3 days, or 4 days. When
Yes.
it is not cured for several days, then
Hmm.
only they go to hospital. So it's already a long.
So, ma'am, my next question to you is what motivated to you to choose scrub typhus in your research and where it is currently going?
It's like a study. I'm going for a 12 month study, so
Okay.
that within 12 months we can see the seasonal variations also,
Okay.
and we can get enough number of samples also for the
Okay.
test for the period of 1 year.
Hi everyone, I am Pragya Tiwari and welcome to another episode of Lab Leaders Unplugged. Real conversations, real insights, and real impact. Today, we are honored to host Dr. Trupti Bajpai, Associate Professor, Laboratory Safety Officer, and Serology Section in Charge at Sri Aurobindo Medical College and PG Institute, Indore. With over 24 years of professional experience in microbiology, infectious disease, laboratory diagnostic, and biomedical research, along with international exposure in South Korea and United States, Dr. Bajpai brings a unique blend of scientific research, academic excellence, and practical laboratory expertise. She is also a recipient of Young Scientist Award and has authored more than 50 scientific publications in reputed national and international journals. As a token of appreciation, I would like to present a film you are. Thank you so much, Pragya and Athnace, for inviting me to this book podcast. Oh, it's our honor. Well, my first question to you is, how did you decide to pursue or you build your career in microbiology? During 90s, microbiology was a new branch, and actually, I was not sure. I didn't knew that what is actually in microbiology. Just I opted for microbiology, but slowly when we started studying microbiology, and I came across uh, the new things and those tiny creatures, how they actually fascinated me. So I continued with this, and now still I ended up with microbiology. In between, definitely I pursued some of the other things during my MTech from IIT Kharagpur. I studied about the decomposition of agricultural waste, and also I studied about the biofertilizers during the next 7 years. Then also I said in USA and South Korea, I worked on breeding of mice, maintaining the mice colonies, okay, and immunohistochemistry and behavior experiments with mice. So, and in everything, and even cell culture media preparation, where I did quality control and did PCR to detect the mycoplasma as contaminants in the cell culture media. So there was a touch of microbiology in almost everything. Yes, still I'm doing microbiology. So basically, if we see these tiny threads, these tiny, we can say they are tiny. Oh, yes. Yeah, right. So yeah, of course, in our lab, they are the like in healthcare, they are the threads. Yeah. So it's really fascinating when we use these. We apply or we use employ these threads to for actioning the treatment and for preparation of advanced vaccines and for the life-saving technologies. Yes. Okay, ma'am, you as you said that you have work experience and radiologic experience in South Korea and United States.
So, how that experience shaped your scientific thinking?
Uh, so actually, there was a lot of contrasting but complementary experiences from both those east and west. तो ये सुनना चाहते हो क्या कि
East or West India is the best. So,
That is
so
something which everyone.
basically, I learned a lot of things there. Like both are different. Like in South Korea, there was we learn ethics, then adaptability. Then they want to do the things very fast, rapidly.
Okay.
Like peri peri, palli palli. They used to say
Okay.
palli palli all the
Okay.
time, like
So it's their local
hurry up.
language.
Yeah, in Korean, palli palli.
Hmm.
So that means do it in hurry, but always we cannot compromise with the quality, like maintaining the
Okay.
quality. And even also there is a consensus based style. And
Okay.
but in USA it's like innovative problem solving.
Okay.
And it's merit driven. Like what I saw there, like you know what they did, they never looked like a person is senior, or whether there are some relations or
Hmm.
contacts, or there is is wealthy. They just were interested depending on the merit.
Hmm.
And so basically I learned empathy. And
Okay.
yeah, I gained empathy and even cultural sensitivity
Okay.
from there.
They are culturally quite sensitive.
Yeah, sure, I learned a lot of these things from there. So definitely these things are helping me to shape myself in while working in India also.
So, ma'am, looking back at your 24 years of journey, what was the most defining movement for you?
uh, See, doing work, continuing with the research is all okay, but I feel when we get appreciated, especially from students
Yeah.
or whoever, like whenever we get appreciation, that's the
Hmm.
most happiest moments I feel.
Yeah. So, when was your first experience that some student came to you and said,
Yeah,
ki,
see,
yeah.
like waiting outside and asking doubts, these all things, like
Mhm.
they don't directly appreciate the teachers, but they talk with others about the
Mm.
teachers, or they talk about the way we teach them,
Mm.
or waiting outside to ask some questions. These all make us feel that, yeah, I think they are appreciating us.
Okay, ma'am. You have authored more than 50 research publications in both national as international journals. So, why is research important in improving patient care and healthcare systems?
Uh, what I think is like when we have too many publications, it's not just about numbers. It's about we have each topic we have gone through, we have studied about that topic, and we have written all the manuscript ourselves, because there was no chat GPT to help us at that
Mhm.
time. So this helps us to study about the disease, about the causative agents of the
Mm.
disease, and the prevalence of those disease, and the pattern of disease, the seasonal variations. All this we can apply in our during our work.
Okay.
So,
So, are we focusing more on research or it has, subsidized a little?
uh, main work is academics. At
Okay.
present, it's academics plus laboratory.
Mm.
And today, the trend is like if the publications are required for promotion, then only students yeah, nowadays they want to publish, because they don't want to sit and work and do some actual research.
Real research
Yeah,
work.
real research. So the trends are changing nowadays.
So you mean to say that previously it was like real passion, like they
Real,
had to do some research
yeah.
and innovative working, and now it is mainly because of promotion.
Yeah, because we need promotion, we want to publish the papers.
Okay, and how are the journals right now? It was very at your time when you started. Was it very difficult to get your work published in reputed journals, and how it is right now?
uh, It was not difficult.
Okay.
Like there were less number of journals at that time,
Mm.
and publication was like we could do free publications also, even
Mm.
paid publications also. So, but nowadays we have increased large number of international and
National
national
journal.
journals, but most of them they are paid, and they pay large amount just for publication.
Ma'am, I have one question. Like these publications which you have made, so everybody has free access to it, or they have to like YouTube, like some premium content we need to subscribe to
It
them.
depends on the
So
journal.
okay,
So
okay,
what are their protocol, whatever they
okay.
have.
So depending on that, the access is
Yeah,
there.
access is
Okay.
given.
Now my next question to you is: what are the some biggest challenge young researchers and scientists face in India today?
The challenges I can say is most of the time it is like the resources.
Okay.
The availability of resources like not available, like the things are not available, and so they want to move to other countries for getting their work done. The main thing is the resource, I can say.
Ma'am, the very common misconception people have when they, think of picking a career in, research, PhD, doing PhD, most of the people have that it takes a lot of time. So, as you have done it yourself, so I want you to put a light on that.
Even I had the same feeling when I finished my masters.
Yeah.
Like PhD takes a lot of time, so
Hmm.
I had to wait for several years to come to this decision that no, PhD is essential.
Okay. Whether
Like
you
for
have to
me,
pursue
well,
it or not. Yeah.
yeah, just I started my job and
Okay.
everything, and later I've thought that no, PhD is important for me.
Hmm.
So it takes time, but in a certain topic we work a lot.
Hmm.
एक पर्टिकुलर मतलब टॉपिक को लेकर हम इतना सारा उस पर काम करते हैं, इतने सारे इन्वेस्टिगेशंस और पढ़ते हैं, तो वो इट अप्लाइज टू आवर एवरीडे जो हम वर्क करते हैं लैब में, उसके ऊपर भी वो अप्लाई करता है, तो हम उसको यूटिलाइज कर सकते हैं. मतलब हमारा जो नॉलेज है ड्यूरिंग दैट टाइम, उसको हम लेटर, आई फील दैट द टॉप मोस्ट डिग्री शुड बी अचीव्ड.
Yeah.
Like
Okay.
we should not stay in between like
Hmm.
bachelor's or master's.
Masters.
Since PhD is the topmost degree, then it has to be achieved. Like then
Okay.
only it will be like complete satisfaction.
Okay. Okay, ma'am. I hope they are listening to it. Okay. So, ma'am, now we will move towards our next segment where we are going to, as you have worked in on infectious diseases in India, so we will have the questions from that segment. Are we witnessing re-emergence of certain diseases in India? And according to you, what factors are contributing to that trend?
See, like sometimes, like when a disease is new, a new disease has been introduced in the population. We have an example of COVID, so we call it as an emerging disease.
Okay.
But when the disease was present sometime back,
Hmm.
but it is not present right now, but it emerges later on, maybe due to mutation in the causative agent, or maybe the disease, it has changed the location in some other geographical location, then we
Okay.
call it as a re-emerging.
Re-emergence.
So
Correct.
re-emergence is most of the time it is seen in case of vector-borne diseases,
Okay.
like we see in case of malaria, dengue,
Okay.
and chikungunya.
Fibral illness.
Yeah,
Hmm.
vector-borne illness.
ओके मैम सो इस आंसर से ही मेरा एक अगला क्वेश्चन है हाउ आर ग्रोइंग आउटडोर एक्टिविटीज़ लाइक इको टूरिज्म कैंपिंग ट्रैकिंग फॉरेस्ट एक्सप्लोरेशन स्पेशली अमॉन्ग द यूथ इज इंक्रीजिंग द रीएमर्जेंस chances or you are saying we are seeing a high number of patients for that particular diseases.
Yeah, as I said about the vector-borne disease, one very important, we can say it's re-emerging in the places, like it is already endemic in some of the regions of our country, but it is re-emerging in some new locations. The main reason behind that is trespassing. Like
Okay.
what we are doing is we are trying to going youth is, it's called as scrub typhus.
Yes.
It is actually called as forest fever. So
Okay.
we are trying to enter in those areas where
Hmm.
we will find the causative agent, we can say.
Hmm.
The
Correct.
yeah,
As people are exploring more, for yeah,
exploring more. Yeah, we are trying to hack those regions
yeah, because
which are
those
not
are,
meant for us
yeah,
actually.
for curiosity purpose they are.
Yeah, and they are not even knowing that what they are doing is the organisms, they are in the sylvatic cycle in the
Okay.
wild, like the same. Or suppose if I give an example of a dengue virus.
Okay.
So if they get human,
Hmm.
like they are parasitic in the human body. So if they don't get humans, they
Okay.
will in wild, they will be in the wild, they will stay alive in the wild.
Okay.
So in
Understood.
the wild animals.
Yeah, yeah, yeah,
Yeah,
definitely.
so the cycle is being completed among the wild animals. Now if we try to
And roach
go
that
there, and
space.
those mosquito, the vectors who are biting, so they may transmit the infection to humans also.
Humans.
Same thing
Okay.
happens with scrub typhus also. Scrub typhus, in case of scrub typhus, what is happening is the causative agents are the larvae of the mites.
Okay.
माइट्स आर घुन बोलते हैं हम,
Hmm.
गेहूं में जैसे घुन
गुन
रहता है
लगता
ना.
है, yes,
तो
yes.
दोज mites,
Might.
the larvae of those mites are actually the cause, they are the transmitting agents.
Okay.
And the disease is caused by a bacteria, a small
Okay.
bacteria. So what happens is those infected mites, they carry out the life cycle among the rodents and small mammals.
Yes.
And the temperature, the warm climate and the tropical climate is and humid climate, they are favoring the conditions. So it's
Okay.
forming a zoonotic a tetrad.
Transmission.
I can
Yeah.
say a
Okay.
zoonotic tetrad. So
Hmm.
what is happening is like if we try to trespass in those area,
Hmm.
those chiggers, they may bite the humans,
Yeah.
and they may transmit the
To us.
organism in the humans also. So this may lead to scrub typhus,
And the
which is a
reemergence of it.
re-emerging disease.
That was very interesting to hear it, the cycle. Okay. Despite many advancement in diagnostic, why do these, diseases still go undetected?
Maybe what happens is, suppose these tribal areas, the disease, if I talk about scrub typhus, now it is in mainly in the tribal regions or where the agricultural land, so mainly it is rural regions. So what happens when the patient gets fever, they try to just they feel that it will be all right in 2 days, 3 days or 4 days. When
Yes.
it is not cured for several days, then
Hmm.
only they go to hospital. So it's already a long period.
Yeah.
And then it depends on the investigations being done on the
Okay.
patient sample. So if we are not introducing all the investigations, then we
Okay.
may miss the diagnosis.
Okay.
And one more reason is, there are different diagnostic tests for the same test,
Okay.
same disease.
Okay.
So it also depends whether the organism is in the patient or the antibodies are present in the
The
patient.
window period of detection.
Yeah, so whether we are detecting at the right time.
Correct.
Okay.
Okay. That's also very insightful, ma'am. So, according to you, how critical is early diagnosis in, overall patient outcome, the treatment?
See, early diagnosis is very important because if it if we are taking a lot of time, we are not able to manage the patient, then the patient may go in the condition of like sepsis, or
Hmm.
sometimes like multi-organ failure. So it is very important to do the early diagnosis.
So, ma'am, my next question to you is what motivated to you to choose scrub typhus in your research and where it is currently going? I would like you to throw some light on your recent research.
Yeah, it's like a study. I'm going for a 12 month study, so
Okay.
that within 12 months we can see the seasonal variations also,
Okay.
and we can get enough number of samples also for the
Okay.
test for the period of 1 year.
Okay.
So,
Ma'am, what are the main objectives of the test?
main objective is like I would like to know the prevalence of the disease. Then we are also looking for the endemic regions from where we are receiving the patients
Hmm.
samples, and also whether the results, whether they are gender based or
Hmm.
they are some age specific.
Okay. So, ma'am, have you so far managed to get some important findings from it, or it is still under?
Yeah, it's still going. We are not finished. But it's almost only 6 months.
Okay.
So we are waiting for the results.
So currently, you have not seen a very conclusive
Yeah,
finding.
we are not reached the conclusion yet.
Okay, ma'am. Ma'am, for your this prevalence study on scrub typhus, there were many diagnostic kits readily available in the market. So, what made you choose Athenes DX Trustline Scrub Typhus IgG IgM antibody rapid test?
ये तो आपके बंदे की एडवर्टाइजमेंट थी। वो
Okay,
पीछे पड़ गया कि मैडम आपको लेना है बस, तो देन
okay,
आई थॉट कि पता नहीं एक किट लेंगे
okay.
और वो किट क्या पता यूज़ भी हो पाएगी या नहीं, सो आई
Mm.
चूज़ फॉर द स्मॉलेस्ट पैक साइज.
Okay,
Then I started in-house. So
okay.
initially we had a very less number of samples,
Mm-hmm.
लेकिन फिर in-house start करने के बाद sample size बढ़ता गया, and now we are using like almost 30 to 40 tests per month.
Okay. Mm. So, ma'am, how was the experience with that?
Yeah, results are good. I don't have any problem with the results.
Okay. Do you think the disease surveillance in India is up to the mark, or we need to work more on that to monitor the areas where some cases must be more and the disease, everything?
So, yeah, I feel that government has like started many programs related to surveillance of disease, and but the thing is on the part of healthcare facilities,
Hmm.
they should provide the data in the real time, which
Okay.
I feel that we are lagging behind in that.
So we are lagging much in data.
Yeah, in supplying the data, like we
Okay.
have the data in our institutes, like I look after that, but sometimes if it is like a holiday or it is Sunday, then we don't send the data.
Okay.
So
So will you
sometimes
send this data to whom, ma'am?
we are sending to IDSP.
Okay.
Yeah.
What's that?
It's like integrated disease surveillance
Okay.
program, IHIP site. So it's a government site, and
Indian
all
government.
healthcare facilities are supposed to send the data in the
Okay.
real time, so
Okay.
that they come to know the prevalence of the disease.
Diseases.
They come to know the address of the location of the patient from,
Okay.
so that they can locate the
Geographical
patient.
areas.
Yeah,
But
so for the epidemiological purpose also.
ma'am, is the monitoring correct, or you want to suggest some changes so that it can become more efficient and better?
It should be on the part of the institute itself,
Okay.
that they are asking their people to manage the data, send the data in time.
Okay.
Otherwise, like those lagged behind data, no, it is of no use when they are sending after 2 or 3 days.
Okay.
So,
Okay, ma'am. Thank you
okay.
for your perspective on that. My next question is, why scrub typhus often missed and diagnosed late in clinical practice?
Initially, it's like we are not sure which infection the patient is suffering from. So, for several days, we are not sure. Like in the early stages, only PCR is positive.
Okay.
So
For scrub typhus.
yeah, for scrub typhus, what I have observed is,
Okay.
so, and by the time patient visits the hospital, the serology tests are positive, like antibodies are formed, and
Okay.
serology tests are detected as positive. But when serology tests are positive, I mean when IgM is positive, PCR becomes
Negative.
negative.
Yeah.
So, and definitely during the early stages, no one will go for the PCR detection specifically for scrub typhus.
Of course.
So
Yeah.
that is missed in the early stages,
Okay.
and by the time patient reaches the hospital,
Hmm.
it's too late, and it's very important to go for all the diagnostic tests so as to reach the diagnosis.
Okay. Now, what is the classic symptom for, there in fever, there are many chikungunya,
Yeah.
malaria, dengue, and then the scrub typhus. So,
In
what?
along with fever, like high grade fever, one important hallmark sign is SHR, development of a scabby,
Okay.
dark colored necrotic mass on
Okay.
the site of the bite of the chiggers, that is the
Okay.
mite larva. So it usually happens when the person usually go in the
Scrub.
yeah, shrubs.
Scrubs. Yeah.
Yeah, so what happens, it is usually in the back region if they are not wearing the full sleeves, or so it is on the legs or in the, yeah, on
Okay.
the back or on the trunk, the hands.
Okay.
So you can see the ishar development, and that is seen in
So it is very
98,
easy.
maybe 98%
So it is very easy to
patients.
differentiate among other.
Yeah, but
Hmm.
it is painless
Okay.
and
Hmm.
no itching, so it is like ignored. No, they
Okay.
don't even bother about whether they have this type of black
Mark or
mark.
not.
It may be very small and it may be a
Hmm.
bigger one, so it is usually missed. Only when we get the positive, we look like retrograde, we go to the patient
And
and
then
then
check
we
whether
check whether they have that
marks or
ishar.
not.
Yeah.
Okay. Okay, ma'am. So, ma'am, now we will move to our another segment where you will be talking about Athene's DX experience, your experience with them, and industry collaboration. As in Aurobindo Medical College and Institute, your lab must be working with different diagnostic companies and institutes. So, what are the key factors or parameters which make you select a particular company's product?
The most important, like we look for the sensitivity and specificity of those
Kids.
diagnostic, yeah, kits, and definitely we also look for the price of the kits.
Yes.
So together, like what I look is the quality of the kit.
Okay.
So I usually take 2 to 3 cards from the company
Demo.
people for demo, and whenever we get some positive samples, and together positive and negative sample, we test them and we look for the quality of the test, and if it is fine, then we just let the store executive know that these kits are okay. Then they ask for the quotations, and they look for
The
the price
purchase
and all.
team
So purchase team looks after that.
takes care of the
Yeah.
rest. So, ma'am, you in your lab has used Athene's DX, diagnostic solutions for both diagnostic testing purposes and also for your academic research. So, how is your overall experience for the in the parameters like ease of use, consistency, result wise, reproducibility?
Yeah, definitely the Athenes kids are doing well. We
Okay.
are not facing any problems till date. So initially we started with the diagnostics, but since we want to do some research study also, we are using the same, continuing with the same kits. And actually, our research is related to what samples we are receiving.
Correct.
So those data only we are using for the purpose of research also.
Yes.
And like in future, like if there will be some students who would like to do
Okay.
further studies, we can recommend those kits
Okay.
for further
So they have managed
studies.
to won your trust,
Yeah,
Athene's
of
products.
course, since 1 year we are using the kits.
So you're quite happy with it.
Thank you. Yeah.
Okay, ma'am. Okay. Ma'am, in a academic institution, how important is for you that a diagnostic company is good in technical support, their responsiveness, and scientific discussion?
Yeah, we come across several company executives who bring with different products to us, but it's not just about buying a kit and start using it. Like from time to time, they stay in contact with us.
Okay.
They provide us technical support. Like they are. Most important is like if we have some issue with the kit, then as soon as we call them, they are
Mm.
available within 2 to 3 hours.
Okay.
So it will be easy for us to manage with the issues we are
Yes.
facing related to the kids. And there are even like I have seen that some of the executives, they also provide some like a 1 hour CME or a
Yeah.
demo, like,
Correct.
and this helps a lot for technicians also.
Yes. Okay. Ma'am, according to you, how can companies like Athenes DX grow beyond and contribute towards more research collaboration and training healthcare professionals?
उसका तो नाम ही एथनीज है।
Okay.
तो
So you have,
तो
you know the meaning of
yeah,
ethnic.
like it's like a goddess. Athene is like a
Okay.
goddess of wisdom and warfare.
Oh
तो
wow.
आपको तो आगे ही होना होगा to had to for the war against the diseases.
Yeah, that's very sweet. You took your time. You were knowing it, the title, or you just studied about it?
नहीं, मुझे एथनीस तो पता ही था, और
Okay.
एथेंस से तो मीनिंग ग्रीक गॉडेस होते हैं। तो
So according to you, we are standing on our
yeah,
title.
of course you are standing on your title, and you can go, like, you will have to be in front for
Okay.
um,
Thank you, ma'am. Ma'am, as a researcher, educator, and laboratory professional, what differentiates a diagnostic company from a true healthcare partner, and where do you see Ethnix DX fitting in the journey?
say like healthcare partners, we can say they are um, uh, relating a patient with a doctor.
Yeah.
But here, in case of like diagnostics, this diagnostics is relating a doctor with the lab
Yes.
health professionals.
Yes.
So and what are lab health professionals? Like lab professionals, they are basically the detectives behind the scene. So
Hmm.
so diagnostics are actually maintaining the relation between the doctor and the patient and the
Hmm.
lab
Yes.
professionals.
So we are fitting into that
Of
perfectly.
course,
Ma'am, what role does rapid diagnostic play in disease management and diagnosis today?
yeah, since we get results at the earliest,
Yeah.
rapid tests like play a very important role, especially during emergency. And to start with a new test, it is best to start with a rapid test instead of going to like a higher level test. We can just come to know about the sample load once we start with a rapid test. Then once we have a higher load, we can shift to some other higher level tests, like we can go for ELISA, or we can even go for clear methods.
Hmm.
But rapid test is one of the to begin with a new test.
Okay. So they are the first,
Yeah,
screening.
screening. Yeah,
Yeah.
of course, it's screening. Mm.
Okay. Ma'am, so my next question to you is how does laboratory manage speed, accuracy, and affordability at the same time?
Rapid tests are helping in
Maintaining
maintaining the
that.
speed.
Okay.
Yeah, and of course, the results are accurate. We are
Hmm.
not facing much problem with the rapid tests.
Okay. Ma'am, do you see rapid diagnostic test and molecular testing complementing each other in laboratories?
It depends on the stage
Okay.
in which we are testing the.
Okay.
It's like if we can do with the rapid diagnostic test, it's not necessary to go for the molecular, then we can
Hmm.
uh, stay with the rapid tests.
Ma'am, if you look at the 5 and 10 years ahead, so what innovations in diagnostic do you believe will have the biggest impact on patient care?
In 5 to 10 years, I see that AI may help a lot.
Okay.
Like because like right now,
Hmm.
antimicrobial resistance is the
Hmm.
major threat, and to fight with that, AI has started playing a role,
Hmm.
and it will become much customized in future. Like AI will help to customize a patient in
Hmm.
association with the disease and the
Okay.
treatment of the patient.
Tailor-made detection,
Yeah,
tailor-made
tailor-made
medicine.
detection. And also the records. Nowadays we have started keeping a record of patients,
Yeah.
digital records, so it's
Yes.
also helping to like patient don't have to move with a file everywhere, and those records are helping wherever they go in the country.
So according to you, AI is very helpful and it is going to
uh,
make a big impact.
yeah, especially like
Hmm.
if we use it in a proper way, it
Hmm.
will be very helpful.
मैम, मध्य प्रदेश में अभी करंटली आपके अकॉर्डिंग कौन सी डिसीजेस है जो काफ़ी चैलेंजिंग है?
सी ट्यूबरकुलोसिस तो चैलेंजिंग रह
ओके.
ही रही है हमेशा से, और उसको काफ़ी हम एलिमिनेट करने की कोशिश भी कर रहे हैं। और दूसरा जो वेक्टर बॉर्न डिसीजेस है,
ओके.
दे आर चैलेंजिंग।
ओके.
उनके ऊपर जैसे हमने अभी स्क्रब टाइफस की बात की है, इसके अलावा जैसे मलेरिया है या डेंगू है, चिकनगुनिया है, दे आर चैलेंजिंग.
Okay, ma'am. Ma'am, as you are in Indore since last 17 years and maybe more than that, so ma'am, आपके according disease में क्या changes आए हैं in all those years? How is the pattern?
Patterns,
Yeah.
yeah, of course the patterns of the disease have changed.
Okay.
Initially, like maybe in 2000, 2000 up to 2010, 2015, malaria was like very much prevalent.
Okay.
But nowadays we don't have the prevalence of malaria, especially in Indore.
Okay.
Like maybe being the cleanest city, तो ये रीज़न हो सकता है कि वेक्टर बॉर्न डिसीजेस, मतलब यदि मलेरिया पॉजिटिव आता भी है साल में एक बार, तो व्हेन वी लुक फॉर द लोकेशन, जोग्राफिकल लोकेशन या एड्रेस ऑफ द पेशेंट, पता चलता है कि वो
Outside
हाँ
Indore.
वो कहीं बाहर से है, या मेनली प्लाज्मोडियम वाइवेक्सा है जो कि रीएक्टिवेशन से भी पॉजिटिव आता है कभी कई बार,
So it is kind of eradicated
या
or
इरेडिकेटेड. डेंगू जरूर पॉजिटिव आता है. ये भी
Okay.
देखने को मिला है कि समटाइम्स द टू आर रिप्लेसिंग ईच अदर. जब मलेरिया ज़्यादा होता था तब डेंगू नहीं होता था, बिकॉज उसके जो वेक्टर्स हैं वो डिफरेंट है, मे बी द रीज़न.
Ma'am, according to you, what role should medical colleges and tertiary care hospitals play in disease surveillance and also public health awareness?
Yeah, what if I tell about my experience, what we are doing, like whenever there are some notifiable diseases, जैसे cholera है, it's a notifiable disease, तो या जैसे plasmodium falciparum है, तो जब भी ये positive आते हैं तो we have to notify it to the government
Okay.
offices. जैसे मलेरिया कंट्रोल, डिस्ट्रिक्ट मलेरिया कंट्रोल ऑफिस है, तो वहाँ पर हमें स्लाइड्स भेजनी होती है पॉजिटिव.
Okay.
एंड वी हैव टू इन्फॉर्म द डिटेल्स ऑफ द पेशेंट. या जब भी कॉलेरा पॉजिटिव आता है तो उसे हमें नोटिफाई करना होता है, सो दैट दे कैन लुक फॉर द सोर्स ऑफ इन्फेक्शन
Okay.
थ्रू द एड्रेस ऑफ द पेशेंट.
So they are actually playing a role in
Yeah, of course,
surveillance.
healthcare facilities are playing role in
Ma'am, now we will move to our another segment where we will discuss about laboratory, safety and quality. So, ma'am, post-COVID pandemic, how has laboratory, safety evolved? Before that, how was, the safety and precautions, equipments, and currently how
Yeah,
it is?
people have become more aware, like personals, they have become more aware about the use of personal protective equipments and discard of the biomedical waste. Like I can say infection control has came into action very much.
Okay, so now people are mostly using gloves,
Yeah, sure, yeah.
masks and everything, sanitizers.
Yes.
What are the some common quality gaps which you see frequently in laboratories? Routine practice.
The difference comes in the awareness. Like there are two things. Even if they are like either they are not aware, but continuously we are taking the trainings.
Okay.
So the awareness is affecting, like now they are using the PPE kits, they are performing the BMW management and segregation of waste. See, what happens is, uh, if you are not wearing PPE, or if you are not discarding the waste in the proper containers, it will not affect your quality of report. Like it will not affect the patient's report,
Yeah.
but it will somehow affect your health.
Correct.
So lab personals should think about that. They should think about that this will
It's for their
affect,
own
yeah,
safety.
it's for their own safety. So this awareness is continuously being made in the laboratories. Yeah.
Ma'am,
through
as you said,
trainings.
ki despite multiple trainings, there are still gaps. So, do you think that ease of training is also very important? Because sometimes we conduct training session for people, but the core message which we want to deliver, it's not very easy. We are not able to say it in a very simple language or simple manner. So, does we need to work on
Yeah,
that?
we are demonstrating also, like to
Okay.
increase the impact. We are
Okay.
not just showing the PowerPoints, we are also demonstrating like spill management,
Okay.
or we are demonstrating the different emergency codes to the some like movie like videos, so
Okay.
that there is impact on the
Hmm.
personals.
They can
So
remember it
just
well.
yeah, we are trying to induce those
Elements for
yeah,
the impact.
yeah.
Okay, ma'am. How can institute, build a culture of quality, compliance, and laboratory safety?
What actually I can tell, what we are doing is we are training the personals,
Yeah.
entire staff, and after the training, monthly we do the audits.
Okay.
So when we do safety audit, we just do it on a single point, like whether they are aware of the hazardous materials, whether they are aware about BMW, whether they are aware about the use of PP, and once we do the audit, then we are scoring, we are giving the scores, and if a certain section is weak or getting a less score, then they are retrained.
Okay.
The training is given through the like infection prevention control nurses,
Okay.
and once they are trained, again we do the re-audit. So after that, we feel that there is improvement. Initially there was just a compliance of about 60%, 65%, but nowadays we have reached up to 92%, 93%. However, our benchmark is 100%,
Yeah.
but still they have tried to approach up to 96% through our
Okay.
trainings.
Even the students working, studying in the institutes, they also get.
Yeah, they are also trained,
Yeah.
they have the in the curriculum, like MBBS students, they have
Okay.
in their curriculum about the hospital infection and control and surveillance.
Okay.
So they are also taught the same, and even in their exams also, they are given the exercises related to infection control.
That's amazing. Okay. So, ma'am, now we'll move towards our rapid fire round. So, I'll ask you questions which you have to answer very quickly.
Okay.
Okay. Ma'am, one infectious disease that healthcare professionals should never underestimate.
HIV/AIDS.
Okay. Are people underestimating it?
Yes, of course, like
Okay.
handling the samples, blood
Okay.
samples without gloves,
Hmm.
and
Even I have observed that many times. Like
yeah,
they are having HCV, HIV, HbAcG samples. They're like कि हमने जिंदगी में कभी gloves use नहीं
that's
किया.
true. That's why. So
Okay.
it should never. And even we don't have vaccines against
Okay.
that. Like we do have vaccines against hepatitis B,
Yeah.
but since we don't have any vaccine for HIV,
HIV.
so it is very important to be careful about that.
Okay. Okay. One quality every young researcher should develop.
Lab ethics.
Okay. Lab ethics. Okay. Research, teaching, or diagnostic. Which role do you enjoy the most and why?
Teaching.
Okay.
Because in teaching, like we teach diagnostics, we teach research,
Yeah.
so teaching,
It's a cumulative of
yeah,
all.
it's everything.
And you like, I feel
And
you
definitely
enjoy
I
your time with
enjoy teaching.
students.
Yeah.
Okay, ma'am. One laboratory practice that every healthcare institution should implement without any compromise.
Infection control.
Okay. They should have a SOP chart or
Yeah.
something. One emerging technology that excites you the most in diagnostics.
Biofire.
Okay. Bio?
Fire.
Actually, ma'am, I'm not aware of it.
Yeah, it's a multiplex automated system,
Okay.
PCR system.
Okay.
So nowadays, like by using Biofire, simultaneously we can detect multiple pathogens.
Okay.
Yeah, causative, as a causative agent of disease.
Okay.
Like if one of the organism is the culprit,
Yeah.
but we can simultaneously detect for all the organism. So we
Okay.
will come to know the result quickly.
In one particular patient sample.
Yeah, in a single sample.
Okay. One public health challenge India must solve in the next decade.
I think rural health.
Okay, ma'am. One piece of advice you would give to young microbiologists starting their career today.
uh, Never compromise with the quality, and there should be adaptability. It's very important.
What continues to, inspire and motivate you every day?
My child.
Okay, your child.
Yeah.
So she is the, sunshine of your life.
Yeah, sure.
Okay. So, ma'am, so we conclude our session today here. Thank you so much for your insights, your valuable, learning which you had in your journey. It was even, get to learn a lot from you.
Thank
Thank
you
you so
so
much.
much, Pragya. Thank you.
Dr. Bajpayee's journey from researcher and scientist to educator and laboratory leader is truly inspiring. Her contribution to medical science and infectious disease research continue to impact healthcare professionals and patients alike. We also appreciate her perspective on industry and academia collaboration and role diagnostic innovation plays in improving patient care. Thank you, viewers, for watching this episode. Until then, see you next time on the Lab Leaders Unplugged at Athens DX. Thank you.